Hello, my name is Haley Roybal, and today I'm going to be talking about Lyme disease. And I do want to go over our 3 learning objectives. So we're going to start with talking about the genus and description of the bacterium that gives us Lyme disease. And then next, we're going to talk about contraction and stages of infection, how we get this disease, and what are the stages of Lyme disease. And then lastly, we're going to talk about our treatment for Lyme disease, if you can be cured, if you can't, and how we can take precautionary ways to prevent this disease from occurring. So secondly, what is Lyme disease? Lyme disease is caused by a bacterium called Borrelia burgdorferi, which directly interferes with the host's immune system. So this bacteria comes in to our bodies and infects us. And its specific species is a spiral-shaped bacteria in the genus Borrelia category. And if we're going to continue to transmission, so the way that this disease transmits between people is it actually starts in a tick. So they can be from all over, and the tick actually is going to bite onto another host who is also infected by their blood, and they have this bacterium in their blood, and then they are going to bite it and then be infected. An interesting fact that I really learned is they have 2 proteins inside of them, and so when the tick gets the bacteria, part of the protein is what keeps it in the tick's stomach, and then the second one is it goes into your body. So ticks pick up the bacterium from infected animals like mice or deer, and these ticks are often called deer ticks. And then they go on brushing by a human. If a human or even dogs are also capable of picking up these ticks, they brush by them and then they attach themselves. And when they are feeding off of their host, they inject the bacterium in their host. Something interesting is that this disease, Lyme disease, is not spread person to person. It is only by the host and the ticks interfering with their blood. So it's not caused by food, water, or air. It's not spread by mosquitoes or other insects. It is just a tick bite. All right, stages of Lyme disease. So there are 3 stages that I'd like to talk about today. Our first one is our early localized stage. So this is during Lyme disease when you first interact with a tick. This could be anywhere between a couple days to a week. After the tick bite, it is typical you'll see the bite and then a red ring around it, and that is the irritated rash. And what that is representing is when the tick bites us and puts his proteins in you, getting the bacterium, your immune system tries to defend the bacteria, and that is what's causing the inflammation and the pain, is your body's immune system trying to fight off the bacteria. So it often includes our bull-eyed rash, which we talked about, and flu-like symptoms. So since your body is under attack, it's presenting our fever and other sorts of things just like that. And then our second one is our early diminished stage. So this is a couple weeks or even after months after getting the bacterium. And now not only has the bacteria spread to just that infected site, it is now getting into our bloodstream, our lymphatic system, and really affecting everything. So you're going to be experiencing joint pain, heart, nerve, and just somatic damage all around your body. And lastly, I want to talk about late disseminated stage. So this occurs up to months or years after the infected bite, which is really surprising that it does stick with you. This bacteria, if left untreated, can be very damaging. So not only are your joints inflamed, just your whole body, which can lead to several kinds of just injuries and pain. So let's talk about treatments today. So if you do get infected by Lyme disease and you got that tick bite and you start noticing certain signs, there are 2 really big ways to stop it, and that is antibiotics. But there's 2 types of antibiotics you can take. There's oral antibiotics and IV antibiotics, and really they are at the doctor's discretion. It is most common to do oral antibiotics, and that one is the best results that we have seen. Not really best results, but most commonly used, so we are seeing higher results from it. In severe cases where it is left untreated, we do go to IV traces, but it's important to know that early treatment with antibiotics is the most effective. So we see 99% effectiveness when it's in our early stage, but when we do get to our late stage, it is harder to cure. It is still curable, but it's a lot harder. Next, we're going to talk about prevention. So how can we prevent this disease from occurring? So Lyme disease is from a tick. So we know that if we can have as least exposure to ticks, that is our best chance of preventing this illness. So that is whether you're going out your side less or staying more indoors or making sure your grass is mowed so you're not in contact with these bugs. Even so much as wearing long sleeves or wearing bug spray, socks, and tucking your jeans into your shoes is all preventative ways from reaching the tick. And if we are outside and we do see a tick, it's best to make sure we're showering right away and we are pulling out the tick out of our skin before the bacterium has time to enter our body. So keeping our yards clean and trimmed and removing the ticks properly and carefully. Something that I noticed over research is that you can get bit by the tick and take the tick out, but if you still leave the head, it is still allowing time for the bacterium to enter your body, which is really interesting. And just a preventative way is just taking care of that tick immediately and not letting it fester. Some interesting facts I saw were really cool is that the name Lyme disease is actually named under a U.S. Connecticut in a little town called Lyme. That is where the outbreak first occurred. There was different places where it did occur, but Lyme County was the main one, and that is where we get our name. And then not everyone with Lyme disease gets the bull eyes rash, and this is important because you can still have Lyme disease and miss certain symptoms. Yes, the bull eyes rash is very common when you have Lyme disease. That is your body showing that it is fighting something, but you don't always need it. Lyme disease is most common in late spring and summer, and this makes sense because when we're thinking of bugs are out and ticks are out, that is hot weather for them to grow and fester. Instead of the winter when it's cold, they typically die off. And people of all ages can get Lyme disease, and that is a really important factor, that everybody has the same susceptibility. It doesn't matter race or age, everyone is susceptible. That's why it really matters to be precautionate. And then something also is pets, especially dogs, can also get Lyme disease. It's not just human hosts, although it is most common we see Lyme disease in humans. That is not the only issue. It can also be in our dogs, so just being precautionate, and if we see a tick on a dog, to take it off and work our way around it. We know we can't get Lyme disease by touching the dog, but if they were to bite us and the bacterium were to enter us, that is kind of typically how it works. All right, and then these are my references. Thank you so much.